massage therapist, Alistair, as our foot model. He's very kindly donated his feet. And I'm going to go through 3 lots of specific taping and then another tape that you can sort of use in a different area of your foot. So do you want to jump one up? Sure. Yeah. Yeah, both would be good. So I'm going to do it 2 ways. I'm going to do the feet, both feet, so that each of the taping techniques on both feet, so that we can get video footage of it from how you would sort of see it, and then another way, so that you can then go back to the Oxfam website and click on this and you can reference it. Patients of mine that have gone onto my website, there's a video there that's about 4 or 5 years old, and it's awful, it's really bad footage, but what they do is they go on and they do their tape and then they pause, and then they do their little technique and then they pause it, and it's just a really good way of, it's almost like having me there sort of coaching you through it. And once you get better at it and more skilled, you'll pick up, you won't need to use the video. Or you can just sit down here as well. Okay, do you want to scoot back, just on your back, just so that your feet are just over the edge. Come a little bit further here. Does everyone have Fix-A-Mole? Does everyone know what Fix-A-Mole is?
Is it in the blister pack?
It is in the blister pack, yes. Yeah. So this is what I should have taken shears out in about 10 years ago, because it's gold. Like basically, if you don't have anything else, you must have Fix-A-Mole, and you need the 5 centimetre width. Okay. This tape is the tape that we generally use underneath strapping tape to prevent allergies from the tape, but it is incredibly durable, and this is the tape that I'm talking about when I talk about taping for blister prevention. Okay. I am slightly anally retentive about how my tape is cut, and the reason for that is to stop it from rolling up when you put your socks on, and for it to last as long as it possibly can. So the little tips that I give you, like rounding the corners and sort of certain things, I'm not just saying that just for the sake of saying it because I'm a bit type A. It does tend to work. And people that have come back have said, oh, I didn't round the edges, and as soon as I put my sock on, it all came up, and 15 minutes of taping's just gone down the drain because you've got to start all over again. So it takes a little bit of extra time, but it's worth doing it. So I'm going to start with the heels, and then we'll move forward to the big toe area and then the toes, and then I'll show you sort of around the arch area. Now for those of you that kind of can't see, does anyone want to, just trying to work, if anyone wants to, from the back row, wants to come and sit down here, you're more than welcome to come down here. Okay, so for the heels, what we need is 4 pieces of tape, and the way that you measure the length is that you measure so that it comes around to be the length of where it sort of rests on these 2 bony sort of ankle bones, okay? So you want to measure it roughly to be that, and you want to cut 4 pieces of tape exactly the same length. And I tell all my patients with this to pre-cut your tape and have it all individually labelled in little snap block bags when you're on the event, when you're on the trail, and then it's done. And when you're 78 k's into it and delirious and you can't speak and you know that you can point to a plastic bag that has your heel taping, it's already pre-cut, it's ready to go, and you're sort of able to sort of coerce the person who's hopefully going to tape it for you, that you're not going to have to do it yourself. It's a little bit easier, but also just for you when you're training, it just makes life that much more simple. So you put all 4 pieces of tape together and you round the edge, okay? That's tip A, type A, personality, being anally retentive, rounding all together, okay? That helps with it, stopping it from rolling up. 2 pieces of tape stay the same, and 2 pieces of tape we cut halfway up and we cut a split up, and that's going to help it wrap around the base of the heel without creasing. So the trick with this taping in particular is that there's no creasing in the tape, because the skin will swell in an area of a crease and you'll get a blister. Okay, so you want to make sure that everything's sort of relatively, well, is smooth, perfect sort of on the skin. So you've got this first piece of tape is going to go around, and it's going to sit just sort of underneath that bony ankle bone there. Okay, second piece of tape and what you do is you lay it on the skin rather than pulling, because you'll pull all the skin sort of too tight underneath. Okay, second piece of tape has one that's got a split in it, And this is going to sit around the rim of the heel. And the trick with this is to get it so that it sits around this rim here, so that it's not sitting too high and it's not sitting down on the plantar surface of the foot. So you want it sitting directly on that rim. And this just takes a bit of time and a bit of practice to get right. And again, you just lay it on the skin. It wants to overlap that first piece of tape that you've put on. And then at the base of the heel, you just cross the tape over so that there's no skin showing between there. So that's your first two pieces of tape. Your third piece of tape is a stirrup strap that starts at the level where these two finish and wraps up around the foot like that. Again, nice and smooth, no creases. And then your fourth piece of tape, same thing, split at the bottom of the heel, overlaps that piece of tape there, and he's got a relatively large foot, so we have to...
No need to apologise.
Now, this is the only piece of tape that it's okay to have a little bit of a crease, as long as it's over another piece of tape. So you can correct that as it sort of comes and wraps around this heel, you're going to have a little bit of creasing, so you'll get little sort of tags of sort of tape here. Again, if you are like me, you'll then grab the tag and cut it off so that there's no bumps or lumps anywhere on the tape. Heel taping. Can you turn over and I'll do this from the other angle?
See the creases you've got on the inside there? On the other side? See the creases?
On the other side, around the other side?
You'd be folding that out, or
You can just gently cut them off.
The bubbles sort of things.
Where are the
On
bubbles?
the other side. See what sort of...
That's the tape, because it's over four, so there's layers of tape on the top. Yeah. Okay, can we do... Oh, okay.
This area here,
Yep.
should that be flattened in? Right.
Ideally, yes, it needs to be flat. Yeah. Now, because he's got a little bit of a piece of tape here, a bit of tape that sort of hasn't completely covered his skin, then you just cut a little bit here. So it's always really good to check. You just cut a little piece of tape, and that just goes directly over the top, so that there's absolutely no skin poking through any of those holes. Okay. So to do it from this angle, same thing. 4 pieces. And you can see you go through quite a large amount of fixamol, so you'll certainly go through. There's sort of 10 metres in there, but you will go through it quite quickly. There are other brands of this tape, Mefix and Hyperfix. This one's by far and away the best. Designed by Germans, and I've just cut that incorrectly. And the others have been made sort of almost to imitate this tape. And Fixamol, particularly for this event, look, they work really well, but for this event in particular, it seems to be more robust. So it is a bit more expensive than the others, but it does work.
Does the tape last the whole walk, or do you
It's a good question. Come down towards me. You do have to... part of the reason that we get you to start taping in training is so that you get to know how long it takes for your tape to need to be replaced. Okay, it's going to be different on a hot day to a wet day. If it's really dry and dusty, and you're getting a lot of sort of dust getting, so it's very dependent. You'll find that you'll get a really good gauge on the longer walks, sort of how long it does take to, for that tape to get to a point where it needs to be replaced.
So everybody should tape? Everybody?
Yeah.
Should you tape before you get blisters?
Yeah, this is preventative taping. This is not treatment, this is preventative. This is to prevent the hot spots occurring which is the friction that occurs that precludes a blister. Okay.
What about double socking?
What we might do is, can we do some questions after I've done this, because we're videoing it, and then we'll, yeah, is that all right? And then we can do that, and we can, I can chat about all of the socks and all that sort of stuff afterwards. This tape, the idea behind it is that it creates like having another pair of socks on. So in answer to the question, and I'll talk about it a little bit later, you ideally shouldn't need another pair of socks, because this is like the second pair of socks, or the first pair of socks. So your fourth piece of tape is going to go overlap the first, place one piece on the heel, and you're going to cross that over nicely, and then you're going to get these little creases sort of up here, which we talked about, and then you'll snip them off. So you can see it takes a long time, and I'm probably quite quick at doing it because I've been doing it for years. But the more you practice, and I actually sort of find if you've got the opportunity, if you get together as a team before you go training, is just to do each other. It's so much easier. But do get used to doing it yourself, because it is important. And you're not always going to be together before you train. Okay, we'll turn you over, please. So we're now going to do this area around here, which does tend to be quite a common spot for blistering, particularly if you've got any callus or thickened skin that's built up around here. We had how many in today? 3 people with exactly the same doing Oxfam blistering around this area, and it's very common. That's the calloused area, big toe in here. So I'll talk about sort of foot care, but it's really important that you take all that callus off, and then you're taping without that callus there, because that's going to help prevent any of the blisters sort of coming. So we'll use 2 pieces of tape for this area. We've sort of worked out that it tends to work better if you tape this area long ways rather than across ways, to stop that rolling effect when you put your socks on. Okay, so what you want to do is you want to get 2 pieces of tape that are going to sort of work their way around this area of the foot. And I might do this one actually, because it's going to be easier for me to do here. There's going to be a point at which you have to go around a corner. So you want to, again, same sort of thing as when we did the heels, you're going to cut a split. So you want to cut a split in one of these pieces of tape, round the edges, same as what we did. And we're going to place gently on the skin. And then you sort of round the corner, and then this piece just sort of gently sits over so that there's no creasing. So that's your first piece. Your second piece just overlaps the first piece. Sorry, I'll do it on this one too. Okay. And then this one just overlaps the first and just sits nicely there. Doesn't need a split, that second one. Okay. And that is often enough just in that area to reduce that level of friction that comes here. For those people that get it here and here, you would need to take the big toe as well, which is a separate, you don't want to do it all in one. So that's a separate one. This is a little bit tricky. It's just a matter of sort of shaping the piece of tape. So you round all the edges, cut a bit of a split in here. And then you just sort of working out how it sort of sits so that you can place it overlapping the tape that's already there, but getting enough of the tape around the toe that you can prevent that friction occurring. And again, same thing as you don't want any creases. If you've put the tape down on the skin, you think, oh no, I've got a crease, just lift the tape up gently, stretch it out, put it back down again, okay? And that's your big toe taping. We'll do it on this side for these guys behind me. So we get 2 pieces of tape the same length. So sort of measuring, that's probably a little bit long, so measuring here, round the top.
And on your previous video, you covered the fixable with another tape.
Yes. So if you are having problems, let's say you've you've tried the tape, and this tape in particular, and you're still getting a point where you're getting a bit of a hot spot. Now, does everyone know what a hot spot means? And that it's just an area that's rubbing and sore and is going to end up more than likely becoming a blister. So you can sort of still feel, or you're still getting a blister in that area. You may want to look at using a more robust tape on top of this tape, which is a brown sports strapping. Don't get the white, because it's a different type of tape. It doesn't have a lot of give. You want the sports tape because it's got a little bit of give in it. And you just literally, as long as that tape that you're putting on does not touch the skin anywhere, as long as it's only on top of the white fixamole, then that's absolutely fine to use. And some people, particularly people with really bony heels, they find that they need that extra robustness of that tape. So yeah. And then just around the big toe, we just do a little one of these. And we're done. Okay. The toes are the next. The main culprit for blisters is the fifth toe. As your foot gets hot and swells, the little toe just tends to get pushed in underneath that fourth toe. And if you've got any ridging or callousing or thick, you'll definitely get a blister in that area. So that needs to come off, and ideally a podiatrist can use a scalpel, take it off, and then you can maintain it with a lovely foot file, moisturiser, all that sort of thing, which I'll talk about later. But this is a really common, and believe it or not, it's probably one of the most common blisters that people have to pull out from. They are excruciatingly painful, and I think it's almost like, you know, the whole paper cut idea. The smaller the cut, the more painful it is. It's the smaller the area of the foot, the more painful it is. So if you've got, I would definitely be taping fourth and fifth. Sort of, if I was doing the event and I had no other, I would definitely do fourth and fifth. For those of you that are getting any blisters on the top of your toes, or if you're worried, just do all of the other four. It doesn't hurt, it only takes an extra minute to do them, and it just puts you in that, it sort of really prevents, or puts you in that much better sort of category for preventing those blisters. So we need 2 pieces of tape for each toe, and the fixamole has these lovely grid-like squares on it. Use that as your measurement sort of tool. So you want 2 squares, width for the first piece, and 3 squares for the second piece. I'll cut a couple of these. So 2 squares first piece, 3 squares second piece. Now this is the only tape that you don't have to round, because it's a bit hard with the toes to sort of get it all perfect. So I'll do the fourth and the fifth on both, and or on both feet. So the first piece of tape, which is the one that's 2 squares, goes lengthwise over the top of here. And again, just be careful about the creases, but you often can't prevent the creases with this one. It's a bit of a tricky one to get it perfect. The second piece of tape comes underneath the toe. So you want to start with the, halfway in the middle of that piece of tape, and this then comes up and rounds, and you don't want any skin showing on the side of the toes, and that piece of tape comes up and joins on the top. So the order's really important. So it's lengthwise first and then that way. Don't do it the other way around, because the flesh of the toe gets squashed, and it tends not to work as well. We've sort of tried that with a few people and it doesn't work as well. So that's your toe taping, and it's basically, for those people that are worried, I do all 4, but definitely fourth and fifth. Once you've got your toes, I'll do the other one. Sorry. So I'll do the little one just to give you an idea, because that's a bit trickier to sort of sometimes to see and to do, because they often tend to be a bit stubby or a bit sort of weird, the joy of having toes. And if you've got really little feet, you might need to cut these slightly shorter, just sort of work out with your anatomy sort of what works for you.
Would it be best to cut those little ridges off with your...
I don't, with the tape, with this one, I don't think it matters as much, no. I mean, if you really, really, really wanted to be particular, you could, yeah. And there's the toes. The only other thing that you could do, like for example, this area here, see how there's an area of skin that's sort of been left? I would ideally make sure that the length of that tape sort of married up to that. So when you're cutting it, make sure it marries up, or just put another piece of tape just across there, so you haven't got this sort of just this small gap between the skin. So a little bit more like that one there. Could get away with that. If there's any, and basically the only other taping I was going to talk about was if there was any other areas that you were sort of getting niggles with. This area here can sometimes be a bit of a concern, and the way that you tape this is you basically sort of shape the tape, you sort of curve the top of the tape, and you just put one piece to curve across here and then one piece to sort of to overlap there. And that's sort of an area that I wouldn't necessarily tape all the time. It would just be if you tend to have problems there. The heels and the toes, if I was doing the event, I would tape them regardless every time I did it. This area here, I don't really tend to have problems with, but for those of you that do, then I would tape if you have sort of issues there, or if you're worried, or if you've sort of got callus in that area. Cool, that's the taping done.